I'm Neil Oscarson, Research Director with Class Research, and I'm here with Mac Boyder, Fellow Research Director. And today we're here to talk about a spotlight report that we published recently on Claro Healthcare. Mac, welcome.
Thanks, Neil.
Would you please maybe start by talking about who Claro Healthcare is, what they do, and what part they play, and why we wanted to focus on this report?
You bet. Thank you. So CDI is a very important space for a lot of healthcare professionals right now. They're looking at ways to both increase patient outcomes, decrease costs, increase revenues through proper coding, and so on. And so CDI is a very important aspect of that. One of the things we were trying to identify with this report on Claro Healthcare was its impact on what they call the comprehensive CDI. So not just a software-centric solution, but service-driven, consultative, coming in, working with health systems to make sure that they're as efficient as possible, to make sure that they're actually maximizing their existing solutions, and to, again, just achieve that quadruple aim of healthcare.
So who was it that we talked to do the research for this report, Matt?
Spoke with 22 folks at 20 unique organizations, so health systems, and we talked with a spectrum of both director-level contacts, some managers, some clinicians that were actually utilizing or being part of the process with their comprehensive CDI. So we got a really good gamut of different perspectives for the report.
And what were some of the key findings that we found as we had these conversations?
One of the biggest things that was both surprising, I think, from the perspective of what the data showed was how the impact, or what the impact can be of both a software and a kind of a service-driven solution. What can be done with a comprehensive view of CDI? And one of the things that came through from providers was the coaching, the counseling, working with these clinicians to help them both to improve and increase and maximize their workflow efficiency, but also to decrease pajama time, decrease the difficulty for that clinician. As you know, Neil, one of the big things we're trying to focus on here in class is clinician burnout, and how do we help those with that fragility around nursing, people that are really struggling right now in the wake of COVID and all the stresses that put on people. How do we help these providers, these health systems, make sure that they are not losing folks, that we don't have to worry about burning people out and pushing them out of healthcare. So CDI is one of the tools, and it can be one of the aspects of helping decrease clinician burnout. And that was one of the findings that we had in this report and another reporting that we've had as well, more broadly on the topic.
It's amazing, isn't it, how important it is to healthcare customers that they both get a good technology as well as a partner to help make them a better organization as they use the technology.
It really is. We see this across healthcare, right? This is something that's not just endemic only to this part of documentation or even CDI more specifically. It is something that is all across healthcare, and it's so important.
So if I'm a hospital and I'm reading this report that Class published about Claro Healthcare, what are one or two things that you would hope that they would take away from that report?
So some of the key takeaways we wanted to highlight and focus, and this is again all from the provider voice, which is what we like to do obviously, is focus on just the provider experience, was looking at how can efficiencies within a CDI extant solution, or if you're going live, you're implementing a solution, how can we make sure that all of the pieces are there? So both from the C-suite all the way down, you have people that are the end users, those that are the directors, again, that are working and engaging, trying to allocate resources, et cetera. They all need to be a part of that process, that continuum of engagement. If you only have engagement with some parts of the process or some people within that continuum, then you're really not going to get the same or the better outcomes that you're looking for. One of the other things that we found through the report was the need for clear and very concise training around CDI workflow. How do you actually find, these clinicians don't have a lot of time, and very candidly, they don't have a lot of time to learn something new. So having a really high ease of use and a very, very robust implementation process is essential for achieving those outcomes that you want with a process or a solution like this.
That's great. And what were the overall experience that Claro Healthcare customers had with Claro? Was it positive?
It was positive. In this particular case, it was actually hard to kind of identify some, Class likes to have a balanced perspective, so we have strengths and challenges. The strengths were pretty manifest in terms of cost, revenue recapitulation, things like that. And also, again, the outcomes around the clinicians, burnout, decreasing that. With the challenges, there were just a few very small issues, and most of those were just things that were like nice to have as opposed to must have in terms of some reporting and so on. But here again, Claro has done, I think, a really good job and has developed a process more than just a software-centric solution. It is a holistic and what they call comprehensive CDI solution, and I think this is where they differentiate themselves from other vendors. And it's one of the reasons why we wanted to do this report.
That's great. Great to hear. And any last thoughts or findings from the report that'd be helpful as we wrap up?
Yeah, one of the things that stood out to me again was if you are going to have a CDI solution, and it's so essential to make sure that you're being remunerated properly, that the codes are accurate. I mean, we're talking about a very appreciable way to impact the quadruple aim of healthcare. How do we decrease clinician burnout? How do we increase patient satisfaction, increase patient outcomes, increase revenues? All of these things are a part of that process, and CDI is one of those things at the tip of the spear that allows health systems, large and small, whether you're an large ambulatory group, down to critical access hospitals, all the way up to large inpatient IDNs. All of these health systems have the same needs, and finding a solution that can tailor to your needs, that's really the secret, right? Making sure that you go into it with the appropriate allocation of resources, the appropriate knowledge of what's the ask on your side, and then making sure that the vendor that you engage with can really deliver to those needs. That's one of the key components for having the best outcomes.
That's excellent, Mac. And certainly at Class, we get really excited when we hear about technologies that are making a difference for organizations.
We do.
Well, thank you very much for your time today. Appreciate you coming and sharing some thoughts about this report. If you'd like more information on Claro Health or any of our other research, please visit classresearch.com.